Is healthcare a moral right? What do you believe a moral right is? Healthcare is considered a privilege in the United States. In order for one to have healthcare, they must either pay for it, have government help, or an employer offer it. Unfortunately, if an individual does not pay for healthcare, they have no benefits. As this hospital, we want to ensure that every patient is taken care of, regardless of whatever insurance they have. Implementing the Code of Ethics, utilizing resource allocation appropriately, and cultural competency, I believe we can achieve this greater good for not us, but our community and family. We must have a code of ethics to create a plan to ensure that the entire team and staff follows the mission, values, and vision statement. We must always have integrity in the hospital at all times. Ethics is defined as right and fair conduct or behavior. It is important to be able to communicate. We work in an industry that communication is very crucial. Communication helps us learn how to talk openly, honestly, respectfully, and directly while showing compassion to our community and patients. Not only is this important, but it is important to learn to hold one another accountable. We will never grow if we do not admit to mistakes and fix them. We must always have the mentality that we learn something new, encourage new ideas, and never judge. We must always follow the golden rule: integrity, justice, competence, and utility. How can we create quality healthcare while utilizing our resources and staying in a budget? New technology and continuous rise of research healthcare costs are on the rise. United States spends approximately 20% of the annual domestic product on healthcare, which is 4 times the average expenditure of other countries. We need to implement maintenance organization, create quarterly inventory to assess where budget spending is and why it's so frivolous. Overspending is preventing us to be able to deliver quality health care. 2014 is a year for changes. We as a country have come so far that it is important that our hospital shows the standard that all is created equal, regardless of sex, religion, or color, that we must learn to improve the outlook of healthcare to minority groups in our community to help reduce minority disparities. We need to implement translators and employees and staff of all races because we want to ensure that our community feels safe and comfortable. In conclusion, our hospital will work tremendously to achieve the highest quality of healthcare. As the compliance officer, there will be delegations for each department, and that will help attain resource allocation, cultural competency, and code of ethics. Everyone will be held accountable, and while doing so, we are open to new and challenging ideas. After all, our community is where we, our family, and loved ones reside.